Welcome to Surrey Heath CCG's virtual annual general meeting. My name's Tom Lawler. I'm the Director of Operations for Surrey Heath CCG. In normal world, at this point, I'd probably run through the housekeeping of the meeting and let you know where the fire exits and the toilets are. But I guess I won't need to do that today, and you probably know where they are where you are. But to help things run smoothly, I think, as we've said, can everyone please ensure that their camera is turned off? The speakers will keep theirs on, obviously, and can you turn your microphones onto mute as well? Just so everyone's aware, we are recording the meeting, so I hope everyone's happy with that. As you can see, here's the agenda for this morning. It has been a strange year, and our plans have had to change and probably not happened all as we intended. But we have still achieved a lot, and it has amazed me actually how many positive changes have been made in spite of what has happened. This has also led to some really exciting plans and opportunities we have in the year to come that we'll run through as well in the presentation today. Part of what we do as a CCG is to have to formally present our accounts in the annual report, and Caroline will take you through these. And so now I'd like to hand over to Dr. Andy Brooks, our Clinical Chief Officer, and allow him to give his own welcome to you.
Hello, everybody, and welcome to our annual general meeting. Thanks, Tom, for introducing things. This is the annual general meeting for Surrey Heath Clinical Commissioning Group. As Tom said, my name is Andy Brooks. I'm a local GP, and I'm also the Clinical Chief Officer, which is NHS speak for Accountable Officer or Chief Executive for the Frimley Collaborative, and Surrey Heath as a CCG is part of that collaborative. You know, this year has been one of the most challenging years in NHS history for ourselves, but also for yourselves as part of the community. And here in Surrey Heath, just like everyone nationally, we've had to respond to one of the biggest issues that health and care have faced in a generation. Rising to the challenges that coronavirus or COVID-19 has presented has changed the way quite dramatically that we've needed to respond and provide services, and we're committed to providing those with our partners, making sure they're of high quality and safe for our local people. I guess an example of way that has changed is this very meeting. I've done a number of these over the years, and normally we'd be in, well, I've often had it in the theatre in the centre of Camberley, where I'd enjoy shaking people's hands. That seems a strange thing to do now, doesn't it? Shaking someone's hand, speaking face to face, meeting people, having coffee and one of those lovely biscuits that we often find in Camberley Theatre, and having a chat, having stalls, and making some connections. And we're here now, sat in front of screens in our kind of new virtual world. I would at this point like to thank yourselves and your families, neighbours and the communities in Surrey Heath at the start of the pandemic for people who took time to clap every Thursday evening. Please don't underestimate the value that that's felt by people who work in health and care. I myself went outside my house, saw people along the street and clapped, and it was fantastic. So again, a big heartfelt thank you. It was really appreciated during the height of the pandemic. Now, the purpose of our annual general meeting is to look back at what we achieved in the last year. As Tom said, we have to do this, but actually, even though we have to do it, I think it's really important that we share with you what has happened in the year. We are accountable to you as the public. Even during the height of the pandemic, we didn't stop the work that we were doing to ensure that we have services in our community. One of the things that happened in May was the launching of a new integrated adult mental health community service to try and bridge the gap between what's provided in primary care and also what's provided in secondary care. This in particular has meant that we've been able to help and support people who were struggling with mental health issues during COVID-19 and provide them with support when they needed it most. It was really exciting, and you're going to hear more about that later in the meeting. As you know, things continue to be a tough time for all of us in the community, and thank you again for your continued support during these unprecedented times. It really does make a difference to the services we have. Obviously, we have really good local hospital, community teams, mental health teams, social care teams, voluntary sectors, primary care. There's all sorts of people working, and your support really does matter, so thank you. I'd like to now hand back over to Tom. He's going to take you through, I believe, what the CCG has been working on in 2019 and 2020. And following from that, one of my colleagues, John Fraser, who is another local GP in Surrey Heath, will share a bit more how we've responded during the pandemic. This is an AGM, and it's really important that we do listen to, you post your questions, so please do pop them in the chat box. We'll endeavour to answer those as the meeting goes on, but that's the way we'd still like to really make this interactive, so please do use that chat box function. So once again, thank you very much for attending today, and thank you for all your support. I'll hand back to Tom.
Thank you, Andy. So yeah, as you say, I'd just like to spend some time looking back on what we achieved over 1920. I'm pleased to say that once again we received an outstanding rating for the assessment from NHS England that they give to every CCG. We're one of only 24 CCGs out of the 195 in England to receive this rating, which I think is very pleasing. And for me, that and the other ratings or feedback we get regarding the good quality of our services, and also feedback from our staff, helps to give an indication that we are doing the right things for you and the people who live in the area. An important part of what we do is to buy or procure the right services for the population of Surrey Heath and Ash Vale. And for me, this gives us an opportunity to do things differently and improve the care and support available to residents. An example from the last year is the adult community services procurement. And we'll watch a video about that service later in the presentation. We can't work in isolation, and we gain real strength from working collaboratively with other organisations. Examples from the last year include with Surrey County Council doing elements of the health and wellbeing strategy, with one key area of focus being the improving the support available for people who are homeless or at risk of being homeless. Another significant change, an example of working more closely with partners, is the creation of the Frimley Commissioning Collaborative that is with North East Hanson Farnham and East Berkshire CCGs. This closer relationship enables us to better use the resources we have available. It also gives us better access to support that we otherwise wouldn't have being such a small organisation or small CCG. This has really proven invaluable actually during the COVID pandemic, and we've been able to call upon amazing support relating to infection prevention and control to support our services and also the local care homes, which obviously has been highly important over the last months or so. We are tending to focus on health services today, but we do work in partnership with county and borough council colleagues to deliver care and make improvements. To help us do this, we're fortunate that we have some key joint senior roles between the CCG and Surrey County Council. And I know Shirley Head, who's the Area Director of Adult Social Care, and Jonathan Sly, who's the Locality Director of Health and Social Care, are here today. And they and their teams are really integral about ensuring we deliver good, personalised and joined up care for those who need it. We can go to the next slide, please. Prevention and self-care is key to what we do, and it's one of the key priorities to help people to live healthy lives for as long as possible. This can be through preventing ill health, such as helping people to stop smoking and supporting them to do that, or it's also about identifying problems early and then supporting individuals to do something about that. For example, we with others have a diabetes prevention program that is offered to people who are beginning to be at risk of developing diabetes, and it will give them the support around health advice, changing their own sort of lifestyle to ensure that they don't get diabetes. Also, it is around helping independence and reducing risk. And one way we've done that is through fall prevention and running some workshops about how to identify ways to actually successfully enable people to prevent a fall from happening. Next slide, please. At times like this and through other means, we really do value the feedback we get from you. And the key theme that has consistently come through is the importance of a good start in a person's life. But I do think it's not good just as listening. We also need to show that we've done something. And we are aware that the support for young people, especially around their emotional well-being and their mental health, is a key area we need to improve. This won't happen suddenly, and I think we've had to continue our efforts to make a difference and build for the future. But there are examples through the year where we have put things in place and hopefully taken those steps to improve. For example, this year we have increased the support for young people with learning disabilities by putting some new roles in place. We've also worked closely with the schools in Surrey Heath, especially in the Old Dean, to build closer relationships between health and education and take steps to enable children and families to more easily access the help and support that they need, and also when they need it. To do this, I'm really pleased that during 1920 we've successfully bid for some NHS England funding, and this is for mental health support teams in schools, which really will be those roles that will help enable that connection of people to support and advice and also other services when they need it. So in the coming year, we'll start to put those in place in the areas of most need, but certainly with a view to expand that across the whole borough and Ash Vale. Thank you. Can I have the next slide, please? I'm pleased to be able to tell you that actually we continue to have good services for people with cancer and have again performed well against the national targets that are in place. It's not only about that support sort of from the hospital when you receive the diagnosis and the treatment, but it's also important that we put in place the right care and support after that. So we have a new role in the community of a cancer navigator, and that role is to help people to navigate the care system and be as informed as they can be about the choices that they do have to support themselves over the coming years. Screening is also a national as well as a local priority, and we've continued to focus on improving the uptake and the early diagnosis around cancer, and obviously, the importance of that. Thanks. Can I have the next slide, please? Here in Surrey Heath, we want to enable people to live healthy and independent lives for as long as possible. To do this, we've built on the previous work that is led by the integrated care team and the joint roles of Jonathan and Shirley that I mentioned earlier. We have used a proactive approach to frailty management. That the aim is to maximise and maintain independence for people who are identified of living with frailty. So by adding some new roles, such as the frailty practitioner that is described, we've been able to support a greater number of people with a more sort of proactive or anticipatory way to try and prevent things from happening, or to at least have the plans in place to when things do happen, we know what is going to happen and how they're going to be supported. This has enabled some positive experiences of care, and there's an example from a patient there on the slide. It has also prevented sort of unnecessary admissions into hospital or attendances to hospital. And for example, I think we've seen a sort of 30 or 40% drop in emergency admissions when people are supported in this way, which obviously is positive. Thanks. Can I have the next slide, please? The health of the whole population is important, but also important is the health of individual groups within the community and within the population. And throughout the year, we've gone out, engaged with specific people and specific groups to work with them to plan and deliver services that will meet their specific needs, really to help people access care. And obviously there are certain groups that find accessing the universal services more difficult than others. Just a few examples of what we've done as shown, and if I just run through them quickly. So first one, in partnership with the Hope Hub charity, we've helped facilitate access to mental health support, stop smoking advice, information on medicines and other preventative interventions for the homeless to really help them, support them as best as possible. We've also worked with the Nepalese community and Rushmore Healthy Living, and we trained 5 diabetes champions to support members of the community and to increase understanding through those champions to the people around the condition, and also how to enable self-care, self-management, looking after yourself in the best way. This education and information for people living with diabetes is key really to help manage the condition, and importantly to hopefully prevent further complications down the line. Inequalities and poverty have a huge influence on health, I'm sure you can understand. And so with counsellors and community leaders, we have run a 3-month project over the year to identify actions and support for people in some of the more deprived communities in our area. This is something we want to continue to focus on, and will be a key part of what we do over the next few years in the areas in Surrey Heath and also in Ash Vale. Thank you. Could I have the next slide, please? Oh, it's a blank one. So hopefully, if the technology works, I mentioned the adult community services, and we'd like to share with you a short video about the new and innovative community services that started in April. It was procured jointly with North East Hampshire and Farnham CCG, and it's a service delivered by Frimley Health Foundation Trust and Virgin Care. It includes community nursing and therapies, community hospital beds, and it's linked closely with general practice and the local communities. The contract is the first of its kind in the country, and I hope demonstrates our determination to work together to provide truly joined up service for local people. So fingers crossed. We'd like to play the video now, and thank you everyone.
Community services are the services that we provide for people living in our local area that are delivered in the community setting rather than in the hospital setting. The community services are incredibly diverse. They include the inpatient beds at Farnham Hospital and Fleet Hospital, as well as also all the specialist community nursing teams, the intermediate care rehabilitation team, and also including the community matrons and the night nursing as well. So some of the key principles that we're working towards is that we've got care wrapped around the individual. We'll be working alongside you, the person who's receiving care, as well as also your GP, obviously the community teams coming out to see you at home or in one of our community hospitals, and also integrating with our acute specialists at Frimley Health to have the best care you can at home.
The most important thing for local people is that they get access to the services that they need closer to home in a timely way. Integration for people using the services means that you see the right person in the right place at the right time. You don't need to be worrying about which organisation is delivering services. You tell your story only once. So it makes that whole journey through these really complicated services that we've got out there much slicker, quicker, safer, and with a better outcome.
Community services are there, they're sort of the jam in the community, aren't they? They hold everything together, they deliver services for patients, but they're also working with a wealth and breadth of other services, and we're all linked together.
We want patients to come to the community services first, to help them manage their conditions locally, and that they only touch our colleagues in the acute when it is absolutely necessary. And if they do have to go into hospital, we're able to support them home in a very timely but safe way.
So I work in a community-based rehab ward where I work together with other health professionals like physios, occupational therapists and doctors, social services, and we work together as a team.
If the patient come in a rehab, we don't know how they are in the community, so we get the information from the GP surgeries about their medication, background, then we liaise with the community matrons, district nurses.
So we are not working in isolation because we look at a holistic approach to patient care. We have very, very close links with Frimley Park Hospital, and I have an in-reach team of nurses at the front door doing that very thing, trying to prevent admission, making bespoke wraparound packages of care for people following assessment and getting them back to their own homes within that 24-hour period.
Our main aim for any patient is to try and keep them out of hospital. No one likes being in hospital. So, as Daniela said, we run our admission avoidance service, which is trying to give as much inpatient care to the patient as possible, but from the safety and comfort of their own home.
Patients I see are normally quite housebound, quite isolated, and the fact that they can have all these services brought together in their own home, it makes the world of difference to them.
We had an amputee gentleman who had a very long stay. We got him home, we got him on his feet again, out with his family, out doing the things that he loved.
We're at the beginning of the journey. The ambitions are to have a truly integrated service that meets the needs of our local population, so that they are kind of happy, healthy at home, but they are empowered to look after themselves so that they manage their long-term conditions or their health needs themselves, supported by healthcare professionals.
And it is innovative. As I say, it's the first of its kind in the country. I think that we should celebrate this unique opportunity that we've got to develop the services for the people of North East Hants, Farnham and Surrey Heath. It's an opportunity that you don't get very often. I think the community contract has awarded this opportunity to us, and we should grasp it and enjoy the outcome.
Hello everyone, I'm Caroline Lovis. I'm the Associate Director of Finance at Surrey Heath CCG. Before I talk to you about how the CCG spent its budget last year, I'd like to say a little bit about how we make decisions about the services we commission. Surrey Heath has always put the quality of services at the heart of our decision making as we seek to improve the health and care outcomes for our population. We want our services to be safe and for our population to have a good experience when they use them. And to that end, we seek to engage with our population through public meetings, patient engagement groups, community groups, or by having representatives work with us specifically as we develop and improve our services. A great example of this last year was we procured a new wheelchair services contract, and we had a great group of wheelchair service users work with us on that contract work. And we feel that we were able to commission a service that they really liked and were bought into. We're aware that there are gaps in services or in how they're delivered, which impact some groups in our population more than others, and that this can lead to much poorer health outcomes for them. So in deciding what services we commission, we consider how best to close those gaps and also how to take a preventative approach, intervening as early as possible to reduce the impact of poor health on our population. Andy spoke about the mental health services that we've introduced in primary care to support those with severe mental health illnesses, and that's a good example of where we had a gap that we are trying to work on. However, like everyone else, we need to ensure that we spend our money wisely and that the services we commission offer value for money. Next slide, please. This slide looks at how we spent our money last year. We received money from NHS England, which is our allocation, and we put together a plan each year as to how that money will be spent. Last year, we received £144.6 million, and we spent £144.6 million, which meant we achieved our statutory duty to break even as an organisation. Of that nearly 145 million, we spent nearly 143 million on services for our population. Just over half of that money is spent on acute hospital services, with our main provider being Frimley Heath. The remainder is spent on GP services, mental health services, community services, prescribing, and continuing healthcare. We were also given £2.1 million for the running of the CCG, which is principally to cover the cost of our staff. You will see from the slide that we spent £1.9 million of that, which allowed us to spend a further £200,000 on services while still delivering our break-even duty. Next slide, please. Each year, the CCG produces an annual report, and this slide contains a lot of detail about what is in that annual report. I won't go through it in its entirety, but I'll take you through some main elements. The full report can be found on our website. I'd urge you to read all 166 pages. It's an absolutely cracking read. There is also a summary report which was circulated with the invitation to the meeting. The report has 3 sections. In the performance section, we set out who we are, what we do, and how we've performed as an organisation during the year. This includes, for example, sections on our successes during the year, how we've been working to improve the quality of services, and how we've been engaging with our population, all of which you've heard a bit about earlier on in the presentation. We also set out how we've performed against national targets, such as 18-week referral to treatment times, and also ambulance response times, because although the CCG doesn't deliver these services directly, we are responsible for working with our providers to improve performance in these areas. The accountability report includes information about how the organisation operates in terms of its governance and decision making. So this includes details of our committees and their membership, plus a statement from Andy confirming that the CCG has discharged all its duties. That means that we've used the money we've been given properly, that we've carried out our work effectively, efficiently and economically, and always with a view to improving the quality of services. This section will also include information about senior management remuneration and also our staff report. The final section is the financial statements, which is my favourite bit, being an accountant. So this includes the detailed accounts and their notes, plus the independent auditor's report. I'd now like to hand over to John Fraser. Thank you.
I think you're on mute, John.
It would be me. Right, here we go. I'll start again. Right. Good morning. My name is John Fraser. I'm a GP in Camberley, Surrey, and also place-based clinical lead for Surrey Heath CCG. So the last few months have been a really difficult time for our communities, and during this period our focus has been and continues to be to keep patients, families, carers safe and supported. Across Surrey Heath, your health care and social care services have made remarkable progress to respond to the COVID-19 pandemic. There's been unprecedented levels of large-scale change made at pace, looking at prioritising services, delivering services different ways, making sure our patients are safe, making sure our staff are safe, and continuing to give capacity to respond to the virus, but at the same time, of course, maintain those other essential services that we need to do for cancer patients, patients with chronic disease, and in particular, as Andy has mentioned, mental health. This has really been a difficult time for a lot of our population, and we've had to step up and support the mental health services as much as we can. And I look forward to showing the video shortly in some of the work we're going to do in that. Behind the scenes, the communication between different groups has been vital. There's been lots of these Zoom calls, lots of these Teams meetings. One of the things that amuses my kids is I am now the most active WhatsApp member in the family. I have groups which are with local GPs, with the consultants, with my nursing teams, with the GPs in other areas. And this has been invaluable, actually. I've loved WhatsApp over this period. I previously, it was a nuisance, and it used to bug me, the kids were on it with silly pictures and stuff. But I was looking prior to this meeting, when we were first seeing these COVID patients coming into the community, we weren't sure how to assess them. Who were the really sick ones? Who needed to go in hospital? Who could we treat at home? When should we use antibiotics? And I was looking at just last night at the stream of WhatsApp, which people were sharing information. Have you seen this article in some journal? Have you seen the guidelines in Oxfordshire? There was a great sharing of information. We were out very, very regularly speaking to secondary care, to our respiratory specialists, saying, look, we'd like to do this, we'd like to change. A particular GP, Richard De Ferris, in the Bartlett group, was fantastic, collated lots of information, was sending guidelines out on a daily basis. So to enable us really to give the best care as quickly as we could, and learning from others, because this has been a real a period of learning. The practices have transformed how they're working. We're doing a lot of telephone work. We're doing a lot of online appointments. We are still seeing patients, and it's very important to understand this, but very often with technology, we can do a lot of the work without seeing them, but when we need to see them in, we're bringing them into separated areas where we can keep them safe and we can keep ourselves safe. We opened a hot hub, a particular surgery closed down, and just saw virus-related patients. Patients with possible viral illnesses, and suitable PPE and equipment was provided to the clinical staff there, and it was tremendous. And a lot of us quite frightened to go and work in those centres, but most people, without exception, people were volunteering to do it, and it was really heartening to see that. We've been working very closely with social care over this period, trying to get patients who are safe to come home. It's often a better place for them, but also it frees up capacity within the hospital. Many of these changes, the technology, the WhatsApp, the different ways of doing pathways will stay with us. And I think COVID, as well as being a horrible virus, has actually brought a lot of change for good. Can we move on to the next slide, please? Oh, go. What a present. Right, I'll keep talking. Next slide is one of our community nursing team. And just give you a few seconds to read that slide. So I just wanted to stress that this has been a challenging time. It's also been an incredibly satisfying time to be part of health and social care. The feeling of teamwork and being joined up working has been tremendous. And also working with patients and the support of patients. It's been really appreciated. This I was last night at Blackbush Airport at the drive-through flu clinic. For those of you who may have heard of this, the reasoning behind it is that we can socially distance patients safely. They arrive in their car, they don't have to get out of their car, so that they don't have to mingle with any other patients. We can get a large throughput of patients through there. And vitally also, we are not pushing patients through our surgery. We do not want lots of people through the surgery, because one of the worst things about this virus is you can be carrying it and not knowing. So we do not want people, even though they feel fit and well, coming in, contaminating the surgery. It has also meant that we've been able to release our clinical staff to keep doing their other work, their cancer work, their mental health work, chronic disease work. So I think it's been real innovative working, and it was a big success last night. But what really impressed me was we had a load of volunteers, marshals, and we were having a cup of tea. There was paramedics there, nurses, doctors, volunteer marshals, and the feeling of camaraderie, the feeling that we were in this together and everyone was doing their best to support our patient group is something that was very special. And Caroline in the slide, the Caroline Roberts community matron, mentions the pride, and I think it's not an individual pride. Personally, I think there is a collective pride about how the system has responded to this terrible virus. So if we could go on to the next slide, please. So what's next? We're watching very closely what's happening with the virus numbers. People come to me and say, what's going to happen, John? Do you think it's going to go bad? Or it really isn't a health thing, it's a behavior thing. The question is, are our population going to follow the guidance? Are they going to behave responsibly? And I think, many of you will have answers to that more than we do. My daughter's at university, and I've drummed into her the importance of social distancing. She rang me and she said, I'm so fed up. There's 40 kids in a hall having a party down, below me. And so if this continues, we're going to see the numbers rising if this kind of irresponsible behavior happens. So we need to keep monitoring this. We need to remain dynamic and responsive, and we will do that. Hopefully, we look forward to hopefully good behaviors. We look forward to a vaccine, and then life may return to normal, but the way we practice healthcare will change. I think there has been a lot of benefits brought in from COVID. I don't know if there's anything further I need to say specifically about the health recovery. I think we've learned from the first wave the importance of keeping key services like cancer, heart disease, diabetes going, and that will remain a focus. So we have a lot of learning, and I'd like to reassure the public that that although we are seeing numbers increasing, that is in no way the way that they did previously. We are also understand this virus a lot better, but the numbers are increasing, and we are watching this closely. But we are also trying in parallel to continue other health services, and we will do that. If we could go on to the next slide, please. This is just to reinforce the message about the masks, social distancing, and responsible behaviour, because this is how we are going to keep our population healthy from this virus. So we've talked a little bit about mental health and the importance of it. Andy mentioned it, and I have to say, in my clinical practice, I have noticed a very, very significant rise in mental health. This has been an incredibly tough time for people. In practical ways, people have lost their jobs. They're worried about paying their mortgages. People have been confined. Sadly, we've seen things like domestic abuse increase because of the pressures of living in confined areas, kids at home, the pressures that may bring. And so we are stepping up our support, and we have a video about a new service which we've talked about, which I think is going to be fantastic to offer an enhanced level of support for some people who are really struggling in the community. So if we'd like to play that video now, please.
MIX is the Mental Health Community Integrated Mental Health Service, and it's a community service for patients with complex mental health needs in the community.
The whole point of the MIX service is there for easy access to mental health patients and to support our GP colleagues with their mental health patients. So we can provide things like brief interventions for people, we can provide general psychological support, and we really look at assessing people's needs and what they need at any given point. So we might be thinking about some of their specific mental health needs like anxiety and depression, but we might also be thinking about some of their social needs. So whether they're a carer, for example, or actually whether they have financial needs or drug and alcohol problems or any other difficulties. So we really look at that mental health but holistic picture of what's going on for someone.
Mix started as a sort of an expansion of a pilot project locally in Surrey. It was an NHS England funded project to try and do exactly that, to integrate the services into the community rather than to have the distinct differences between primary and secondary care.
Since we started in May, we've had 82 referrals, so that's 82 people that we've supported. And obviously we work really closely with GPs as well. So some of those people might be people needing mental health support, but also we've, particularly in Surrey Heath, we've identified there's a lot of carers out there who actually need additional support.
Part of the team is employed by Surrey and Borders, and therefore they have more access to the specialist services, obviously referred in by GPs, so we've got a closer relationship with our mental health team.
My role as a community connector is to assess patients that's referred via their GP to our service, to assess their emotional well-being need, and to connect them with other resources in the community. We link up the patients, we're bridging patients to services in the community like Catalyst, the Welcome Project, Richmond Fellowship, the CAB and social prescribing.
During COVID, a lot of the world shut down, but actually we know that a lot of people with mental health problems really struggled through COVID. There was a lot of isolation, there was a lot of anxiety around, and a lot of their normal support strategies weren't there, so their support structures weren't there. And actually it was really important for our service to keep going and expand during that time, because it's obviously not just through that crisis point, but also that the future. We know that we're going to have many more people with mental health problems and social problems coming through as unemployment goes up, as people have more financial difficulties, and as that level of stress continues.
So patients that I have supported so far, she's in her 50s, she's the carer for her daughter, and she also worked part-time. And during this time she was struggling with benefits, income support, lack of furniture in the home, so I linked her up with CAB to help her with her benefits. Also had a local charity that did amazing work with her. They bought her brand new furniture, like a mattress for her bedroom. They're supporting her with wardrobes, and also link her up with some food parcel, and she collected food parcel from them, which is fantastic. And we linked her up with Richmond Fellowship as well to help her with employment support.
This service aims to, is for anybody over the age of 18 who has complex mental health needs, who aren't currently under the care of secondary care services, who need more help and support in the community. And we're hoping that we can roll out the service for the whole of Surrey Heath. Initially it's been based on areas with increased deprivation because of the fact that they've often had barriers to being able to access mental health care. And we're aiming to bring this service to everybody so that everyone can have the mental health care within the community for the future.
Okay, so I'm conscious of time, so I will just briefly run through. As I said, the clinicians are not only reacting to COVID, we're trying to maintain the health of other conditions, and also our leaders in social care and health are developing other services where they remain busy. So we've got lots to look forward to. So individually we're going to stay well while clinicians are going to keep working. We've got new services, NHS 111 First, the community deal, and something that I personally think very exciting is a possible merger of the CCGs, so more collaborative working. So there is lots happening behind the scenes as well as the clinical work. If I could just go on to health priorities. That's the next slide. I'm not seeing it coming, but I'll just talk. Yeah, someone's gone to questions. I think that may be time. Okay, so I'm seeing a blank slide. So our priorities: mental health and well-being, as we've said, aging well, tackling inequalities, developing our people, partnerships, and supporting general practice. I've touched briefly on the flu, the importance that everybody who is eligible for flu should get flus. not going to be a good winter to get flu, and influenza vaccine will protect you from that. So I've talked already about the Blackbush service, so I'll answer questions if necessary. So thank you for listening to me. Thank you to everybody's support, and particularly the part the patients have paid. There's exceptions, very few, but we've had overwhelming supportive, cooperative, helpful patients, and that has made our job much more satisfying and much easier. So thank you for the support. So any questions? I hand back to Nicola.
Good morning, everybody. My name's Nicola Airy. I'm the Managing Director for Surrey Heath CCG, and Kaylee, who supports us with our comms and engagement, and I are going to go through the questions section. Just to say, if we don't cover everything off, we're going to answer all questions and post those on our website within the next 7 days. So don't be frightened that your question won't get answered. The way we're going to do it is Kaylee's going to read out a question. I'll then hand it over to one of the team. We'll answer the question as best we can, seeking clarification if we're not too sure what you're getting at. We did receive one question in advance of the meeting, so we're going to start with that. And the question is, can the CCG provide assurance that COVID-19 has not adversely impacted on the integrated care resources available for local residents? And I'm going to ask Caroline to answer that question.
Thank you, Nicola. Yes, I can give that assurance. There's been no reduction in the financial resources available for out-of-hospital services in Surrey Heath as a result of COVID-19. The CCG's received additional funding from NHS England for extra costs incurred by GP practices and community services in their response to the pandemic, which has allowed them to support our most vulnerable and maintain access for the population. We've also received additional funding to support home-based care or residential care for allowing people to be discharged from hospital more quickly and freeing up hospital beds for those who need them. And to date, we've received an additional £1.7 million worth of funding overall for COVID. So I hope that gives some assurance on that.
Thank you very much, Caroline. I'm now going to hand over to Kaylee to ask the first question from today's session.
We've had a message from Bill, who has said, can you say something about the provision in Surrey Heath for testing in the COVID virus?
Apologies for the echo on that. If I could ask people to switch off their microphones when they're not speaking. And I'm going to hand over to Sarah Bellas, who's our Executive Director of Nursing and Quality. Over to you, Sarah.
Thank you, Nicola. Yes, Bill, testing has been a challenge, hasn't it? Apologies, my dog's barking in the background. So your question was about the provision of testing in Surrey Heath. So the way that we access testing generally is something called Pillar 2 testing. That means testing of the general population when they're symptomatic. And we've seen a huge demand on that testing when the children went back to school, where it was impossible to get a test. So the way that testing service works is you either go online and book yourself a test appointment, or book for a test to be posted to you so that you can then take the test yourself and pop it back in the post box. This is quite successful. I've used this method personally. It comes within a day, and you just post it back in the nearest box that's got priority boxing, and on the website when you look it up it tells you how to find a priority box. Or you ring the 119 number and you are then offered to book an appointment. Now possibly people you know or you've experienced that if you've been tried to book through 119 or on the online to go to a testing site, this has proved to be a real challenge because the tests have been used up test lots have been used up very quickly on a day, and people have been offered tests a very long way away. The testing service will offer you the closest test to you within a time period. and they do it based on the availability that they have. But that's getting a much better now, and people are starting to find it easier and getting their test results back. So there's 3 ways you can do it. You can book an online test and they'll direct you to your nearest test service. You can book to have one put in the post to you, or you can contact 119 and they will direct you to your nearest one.
Thank you, Sarah. The next question, Kaylee.
So we have a question from Liz. Her question is, I'm aware that some people are suffering long-term effects from COVID, such as fatigue. What services are being resourced and or set up to support these patients to manage and recover this condition?
So I'm going to take that question myself. As the question implies, there are a variety of needs that are part of post-COVID. These range from people who have been in ITU that need support after they come out of ITU, to people who've had COVID in the community and haven't required any inpatient admission. Just to reassure you that across the system, we are anticipating that there will be an increase in demand due to these post-COVID needs, both physical and mental health needs. And so part of our planning for the next phase is to make sure that we've got enough capacity, not to just deal with new cases of COVID, but also those people who need support, whose acute phase of the pandemic has finished. Hayley, the next question, please.
So the next question is from Trevor. This is about people having difficulties booking appointments with an overly long process and receptionists that don't know this year's flu rules. Elderly finding it very difficult, and the length of call wait is prohibitively expensive for those on low incomes with limited call minutes. Question is, what can be done to make the front end more accessible?
So I'm going to ask John to cover that question from his own experience in practice. So John, over to you.
So the difficulty is that when patients call through, there is a new response. So it's very different. So we have to explain that we have a triage system. We have the opportunity to use email, electronic contacts. We had 85 emails in my practice on Monday, trying to be responsive. And this takes time. I am conscious of this, and included in that is then obviously the option to discuss your flu requirements. So it isn't. You have to listen to a rather long message, sadly, because of the different and new options. We personally have invested in a new telephone system in my practice with extra lines to make sure that people don't wait as long. I think it's a fair point. I don't have a simple answer. We can look at it. It is just a very different way of accessing health, and we have to explain that at front end, and that is time consuming. But I can assure you that we're putting more receptionist staff on. We've upgraded our phone system. We're trying to make it as slick as possible, and I'll take on board that comment. I'll speak to my manager about it, but it is there is a lot to tell patients, because they don't just need flu. They may need their diabetic follow-up. They haven't had their cervical smear. They may have a mental health crisis. So they have to be directed right at that front point to know where to go.
Thank you very much, Tom. John, we're coming to the end of our session, so I'm just going to cover 2 more questions before we finish, just to reassure everybody that the other questions will be answered on the website. In a moment, I'm going to hand over to Tom to talk about CAMS services and access to mental health support for children. And I'm going to ask Andy to finish off with the questions about use of video and how we remain personal in our care that we provide to the residents within Surrey Heath. So Kaylee, if you could just share the CAMS question, please.
Yes, so this question comes from Councillor Garrett. This is in regards to before COVID, CAMS and children's services were stretched. As we all know from the stats, there will be even more mental health for families and children moving forward. What are we doing to improve the system and make sure that the most severe of these cases will be dealt with as a priority?
Tom, over to you.
Thank you. And firstly, I think we share that concern, and but certainly we are working as a system to mitigate the risk. We do indeed prioritise those most in need and get the access, and certainly that's what's happened over the sort of COVID period. We've also got in place things to improve access for people, so a 24-hour, 7-day-a-week helpline. There's digital options, online resources available, and also we'll put things in place and are continuing to do things to improve the single point of access and access points for people, either for mental health or for physical health services, and the two talking to each other. So it truly is a single point of access, not multiple single points of access. The main focus, or one of the main focuses, and I spoke about it earlier, is that earlier support for people and knowing how to access that support. So the mental health support teams is one of the key elements that we're putting in place to make it easier to get support and to get the right support and the appropriate support. And linking together schools, education and health, and particularly general practice. And we have planned events to do that, to link together the different partners so they know who to talk to and can actually wrap that care around the person, that support. It is a Surrey service that we have, and we do work closely with Surrey County Council and the other CCGs and the provider to work through these issues and make them better. So we are doing that. And in parallel with that, we actually are in a procurement process at the moment and have a new contract planned for April of next year. And firstly, there's additional investment going into that, and the majority of that additional investment is around early intervention and doing things in a different way, so getting different organisations involved and the right ones to help with that early intervention, early support, try and help things as early as possible so they don't escalate into more serious needs. So there's certainly things we're doing to both now and looking forward to the future to make it better.
Thank you, Tom. And the last question we're going to cover off today, and Andy, I'd be grateful if you could hand back to me once you've finished, is really a cluster of questions around a video consultation. So you'll see on the chat there's some really positive feedback about the use of video, but there are concerns about accessibility and also some questions about why it's not consistently used across all practices. So Andy, if you could cover that, and also the point that was made about how do we stay personal in our support to people in an environment where we're doing a lot more remote working. So over to you, Andy.
Thanks, Nicola. I guess, first of all, just to say there's some really good questions here. One of the benefits of doing this is to listen to what people are saying and to learn. We really try hard as a CCG to do what we can, but we also recognise things aren't perfect, things do need to change. So you telling us this is really helpful. At previous events we've kind of had, you said we did, and hopefully we'll reflect next time we meet how we've taken on board things that you've told us. Going to I guess the question about personal care, as a GP, I was going to say things sort of changed overnight. It wasn't quite overnight, but it was rapidly, within a few days, I'd gone from seeing 40 people face to face for consultation, sometimes more, to suddenly that being very, very few people, and it really changed the way I practiced medicine. And one of the reasons I love being a GP is that personal interaction. It was we would use more digital technology as part of the NHS's long-term plan. What's happened is it's overnight suddenly changed, and there have been some benefits from that, using, as John described, people being able to book appointments online, emailing GPs, sending in photos, videos, telephone calls, and those really do have some benefits. We have to balance the need of seeing people face to face, and there certainly is benefit of doing that, with the risk, as John and Sarah have described, is that there is still COVID out in the community, and therefore the least contact we can have appropriately, clinically appropriately, helps to minimise the spread and minimise the risk. However, there are still circumstances where we do need to see people face to face, And just to reassure everybody, there is still that option where it's clinically necessary. We also know that it takes longer to see people face to face, about 2 or 3 times longer. And therefore we have to think about the capacity of the system to cope with that, particularly as we're now seeing levels of access into primary care that are in some areas higher than was before, people using health services. So we need to try and how we can meet the needs of the population. In terms of accessibility, I've got some patients who are deaf, and we do use translation facilities on the phone and the video, and that's been really helpful to do that. Clearly, I think one of the things that we do need to take away is thinking about how we get the balance right between the telephone, the email, the video, and the face-to-face. As John said, one of the things we've been doing very well is learning and sharing good practice. So I think how can we look and share good practice to make sure that we do the right things that we can for our communities in what is still an ongoing pandemic. And as we maybe anticipate, things may also hot up again, so we also have to make sure that we're flexible. So our commitment to you is that we will take that away and look at it and make sure that we can do the best we can. Hand over to you again, Nicola.
Thank you, Andy. So just to bring the session to a close, we truly value your comments and your questions, and despite the fact that we've been online, hopefully you found it an interactive session. We will put all the questions we've answered today and the ones we haven't been able to answer on the website in the next 7 days. Just an ask for us. In a second, 5 questions are going to come up on the screen. We'd be really grateful if you could answer these before you leave the chat. The answers will be anonymous, so we won't know who said what. We'd be really grateful if you could complete those 5 questions. Please all keep safe. We will continue to do the very best we can for our local population, and we'll feed back the answers to the questions we didn't cover as soon as we can. Thank you very much, everybody.